All right, well, thank you for coming. My name is Lazar. I'm a physical therapist here. I'm one of the newbies here. I've been here since October and just extremely happy. I love working at this place. I love my fellow employees, the patient population here. It's just a great place to be. And I get inspired every day from fellow employees and the patients I see here, because everybody who comes in here, for the most part, really wants to get better. And they're quite willing to do the work for it. And hopefully what I talk about some today shows the importance of doing the work to deal with something like chronic pain. So a question already came up about what qualifies as chronic pain, but let me give you just some stats first. So these are statistics that come from the World Health Organization. This was back in 2022, so some of the numbers may have changed, but so when you see these numbers, I mean, up near probably 2 billion people is suffering from chronic pain. And so this is something that, so we use MSK for musculoskeletal. And so it's something that is very rampant in society. Okay, this is a problem for a lot of society. I think the numbers might be even higher than this sometimes. Okay. When it comes to prevalence, the one that shows up in most of the research literature is low back pain. Okay? Most people at some point in their life are going to suffer with some degree of low back pain. And that it's been researched to death, and it continues to be a huge burden in the healthcare system. So, I mean, so many people miss work because of low back pain. They're just horrible outcomes when it comes to somebody missing work for low back pain. If they're out of work for a year, their probability of returning to work is extremely low. So low back pain has been a big deal. It's been researched a lot, and there's still not a magic treatment for low back pain. Let's see, leading contributor to disability worldwide. Okay, so this is a lot of people that are in pain. Just, I mean, this is not just limited to low backs. It can be, you know, our biggest ones are low backs, necks, shoulders, knees. Those are probably the top 4. But some of you may have experienced pain in any or all of those areas and more. So there are a lot of areas that are susceptible to joint pain. Okay, limit mobility, dexterity, leads to early retirement. I mentioned the thing about work. And it also leads to other major problems, including mental health problems. Okay? Now, we have this aging population, so they're saying by 2050, 20% of the world population is going to be over 60 years of age. And so, I mean, these are significant numbers that we have to contend with. And a lot of the population we have here is definitely over 60, and it's something that keeps us all very busy. Okay, and then now disability, it's not like because we have these higher numbers, if I'm in the way at all, sorry. If we have these higher numbers of disability, it doesn't mean that all of a sudden we're discovering the best way to treat it. Okay, it's something that we're trying our best to make this better, but disability only is on the rise overall. Despite all the research that exists, disability continues to get worse and worse. People are not, chronic pain is not diminishing. It's only growing worldwide. So this is something we really need to address. Now, when it comes to pain, I mean, many of you have been asked about that 0 to 10 pain scale. And this is something that can be very cultural also. I used to treat, especially as a Spanish speaker, I treat a lot of people mostly from Mexico and maybe other Latin American countries, and culturally speaking, I almost gave up on the pain scale, because when I give them, okay, on a scale of 0 to 10, what's your pain? And I would get 20s. And so at times it just can be really difficult. It really depends on the population you're dealing with, but you need to educate patients in what that pain scale is exactly. But some people, it's like they're off the scale. They're in so much pain. So I want to talk a little bit about what is pain exactly. Okay, and so this is the definition that comes from the International Association for the Study of Pain, one of the premier organizations that really tries to have a consensus statement on what pain is and what it means to people. And so I think this definition is extremely important. I don't like to read off slides much, but I will read this definition out loud. An unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. Now, there are a number of things I want to make stand out in this definition. So the first one, I don't know if you've ever heard of the nociceptive system or nociceptors. Okay, well, nociceptors are basically our alert system. Okay, and you need to stimulate this alert system in order to experience pain. Now, all of you are sitting on nociceptors right now. I mean, there are nociceptors that exist throughout the body. So usually if you've been sitting for a little while, those nociceptors are going to start to say, you know, I'm a little bit tired of being here. And they're also known as first order neurons. What they do, they'll send a message up to the spinal cord. That message will go from the spinal cord up to the brain, and the brain will decide whether it needs to produce pain or not. Okay, and the brain is constantly evaluating a lot of stuff all at once. But it has to kind of make this decision, is this a big deal? Maybe if I just shift over to the left butt cheek for a little bit, okay, I'm good there for now. But then after a few minutes being there, it may say like, I don't really like this that much, and it'll tell you to move to a different position. So if any of you are getting uncomfortable at any time, feel free to move around and fidget. That's a fine thing. But so this kind of alerts the brain. The message goes to the spinal cord, but a lot of times the spinal cord will just say, we know this, we don't need to send that message off to the brain, and we can hang out here for a while longer. But if it starts to perceive something like a threat, then it'll send that message up to the brain, and the brain will say, do something about this pain. Okay? This is extremely important. Too often people associate pain with tissue damage. Okay? And these things are not the same. If you're in pain, it does not mean you've damaged tissues. For example, if I told you to go and stand up and you experience a little bit of back pain right there, it doesn't mean you've just herniated a disc or you've done something horrible to your body. It's just your brain has perceived some sort of threat. Your brain is concerned with one thing primarily, and that is your existence, your survival. And so if it detects anything that it perceives as a threat to your survival, it will do something to make you not do something stupid that will threaten that survival. Okay? So I talked about threats. Threats, danger signals. That's the brain's job here. It's trying to perceive that there are threats or it perceives danger. And so if it perceives danger, it will send messages down to that area of the body to produce pain. And then there are many other factors. We have these unconscious factors in this defense system that can interact and influence pain. Now, when it comes to, let's say you've had an injury, and even I'm thinking of a story I'm going to share, and I'm already having a sensation just from thinking about that story. I didn't do anything right now to threaten my tissues, did I? But for example, I had this one knife that is very sharp that I use for cutting bread. And on several occasions, I've found finger to go thinking it's still bread. And there's this one spot I have caught too many times. And it just starts bleeding, and it hurts, I curse a little bit, and then I go get a Band-Aid on it. Well, anyway, just talking about this right now, I'm feeling a little tingling sensation right here. Just from talking about it. I didn't do any tissue damage just now, but talking about it, my brain remembers very well. I mean, what people often call muscle memory. It's not muscle memory, it's brain memory. So the brain is sending that message. It's like, ooh, sometimes even handling that knife, I'll get the sensation there. So it's fascinating. I try my best to cut bread by curling my knuckles like this now. You'd think one would learn, but we are humans. Are there any questions about that so far? Okay, because this stuff, I am trying to make the very complex thing of neuroscience and neurobiology and neurophysiology of the brain, I'm really trying to simplify it to the Twitter version, or something that you can talk about at a cocktail party. All right, so when I was talking about the nociceptive system, there are certain neurons that detect pain. Okay, so the non-noxious mechanical stimulus, like you get a little stimulus with a feather, these are known as the A beta fibers. These messages go up to the spinal cord, and that's where the spinal cord is in coordination with the centers going up to the brain, known as those higher centers. And a lot of times the decision will be made right at the spinal cord. It's like, oh yeah, that's just a feather. We don't need to tell the brain anything. We're familiar with that. Now, when you get some other kind of stimulus, like hammering your finger, cutting your finger with a knife, things like that, you'll trigger these really fast fibers. They're known as A delta, and that will send a message up to the spinal cord, which immediately sends, this is nanosecond, okay? Immediately sends a message to the brain, and that will produce pain there, okay? Now, that's what you get with the noxious stimulus. Usually when you get something like heat, okay? For example, peppers. One thing in the spicy part of like a jalapeno, there's something known as in there as capsaicin. And in many studies, when they want to produce pain in people, they will use something like this capsaicin and apply it to the skin. And when the person says, oh yeah, that's a 4 out of 10 pain, that's when they want to apply some kind of technique to see if it will influence that pain at all. Like a friend of mine who was doing a study on spinal manipulation, he was using this capsaicin. He would apply it to the area of the body, and he'd kind of say like, yeah, that's starting to get a little, literally spicy in the area. And so then he would do like a manipulation of the spine and then retest the sensation in that area. It's an interesting way to do that. But so they will tap into this. You also get that with temperature. Now when it comes to chronic pain, you can think of C for chronic. Usually people with chronic pain are stimulating these C fibers much more often. These C fibers aren't quite as precise. Like for example, if you've hammered your finger, you've got a lot of those A delta fibers right there, because you can pinpoint exactly where it hurts, and usually it's a short-lived type of sensation. But when if you've stimulated something like these C fibers, a lot of times the pain is a lot more diffuse, much less easy to define, and so chronic pain tends to be associated with a lot of overstimulation of those fibers. Okay, there's this guy, Lazar. He's been instrumental in many things of the neuroscience of pain. He's done many studies over the years, but he came up with this whole theory of the neuromatrix. And so basically, showing that pain is so multifactorial, it's not simply like tissue damage, pain, okay? You can have many other things, prior learning, okay? Like in the case of my knife cut, okay? I've learned that when I slice through my finger, that's going to cause some tissue damage and it's going to cause pain, okay? And just that prior learning, it's still embedded in there. Just talking about it gives me a sensation there, okay? Past experiences along the same lines. Other systems, there's been a lot more research. I don't have comprehensive knowledge on this part, but the immune and endocrine systems can really play into pain quite a bit. Okay, so people with suppressed immune systems can be much more susceptible to chronic pain. Okay, the autonomic nervous system, are you familiar with that? So the autonomic nervous system, there's the sympathetic and parasympathetic. So right now, hopefully, all of you are in a parasympathetic state. Parasympathetic basically means rest and digest. You're sitting here listening to this information, digesting this information, and so you're in a state where it's calm, okay? Whereas sympathetic is the fight, flight, or freeze, okay? Like a wild animal comes in here right now, and all of us are just going to go into, blood's going to rush down to our legs to help us prepare to fight or flee the scene. In some cases, just freeze. Okay? Now, a huge problem in modern society, think of being in traffic, okay? You're stuck in traffic, okay? You're really in a sedentary state, right? You're just sitting there. But a lot of times your shoulders are up in your ears, you're tense, you're gritting your teeth, you're cursing, and so you're getting very frustrated. So we're in this sedentary state, but our alert system is all fired up. Okay, and so usually people that are in chronic pain are living much more closely to or they're living closer to a sympathetic state, and they're in this state way too often, and they just can't, they're in this vicious cycle, they just can't escape from it. And so the pain itself can produce that. Okay? Then you get this information in the nociceptors. Like some of you that may have shifted some across one leg over the other, your nociceptive system is smart and it's telling you, okay, it's time to change positions. So a statement I use all the time with my patients is, your best posture is your next posture. Okay? So don't be shy about shifting positions a lot. Let's see, I don't know if I should plug this in. But we're good for now. So anyway, you take a combination of all these factors here, and this is going to result in pain. So pain can't be it's not just related to a current injury. It's something that can be stirred up from so many other factors. Okay? So most of you probably have some kind of incident that happened, and you think about that, and it may trigger some kind of response, a pain response even. So let's just talk a little, I like these graphics a lot, just talk about normal sensations. So we have like those heat, those temperature, chemical or mechanical stimuli. Okay, that message goes to those A delta fibers, and that will produce pain. Okay, that's a normal response. Then if it's something that's like, say, a feather, it'll just be interpreted as touch. Okay, and that's a normal state. This is something we want active and healthy in our system. But when you get somebody with a state that's known as central sensitization, now, central sensitization is basically the nervous system overprotecting us. Okay, we're in this state that even a non-noxious stimulus can be painful. So for example, you may get a noxious stimulus, something like temperature, chemical, or mechanical, and you can have something known as hyperalgesia. So let's say I hit my thumb, and usually that'd be kind of like, ow, and then it's gone. Okay, but maybe somebody with hyperalgesia hit the thumb like that, and it's like really painful for a long time. The nervous system is overprotecting you. Okay, and this is very common with chronic pain. Now, something that's an even worse state is when you develop something known as allodynia. Allodynia is when you get a non-noxious stimulus, so it's supposed to go to those A beta fibers and just say like, oh, this is nothing, it's just a feather. But literally there are people that have such horrible chronic pain that just the contact of their clothing or the sheet of the bed on top of their arm, let's say the pain is right here, that produces like just red hot poker pain. It can get that exaggerated. And some people with these kind of conditions, they make the maps in their brain are so distorted. Like you ask them, where does your hand end? And they may describe, my hand ends about here. They're that distorted. It's just their nervous system is so thrown off, and their brain is overcompensated so much that they perceive their hand as that large. So it's really crazy how chronic pain can play into this. And usually the treatment of that there's a lot of, it's not just psychological, but there's a lot of graded exposure that people have to go through to get to this. So it can't be just through exercise, but that's a more extreme case. Now, going back to this concept of central sensitization, this is a typical, let's say you sustained an injury right here, okay? So we got pain level here and time over here. So usually the pain level right at the time of an injury is really high. We get way up here, but then the natural progression, usually over about a 6 to 8 week period approximately, will start to diminish. Okay, and then the tissues start to heal, the body heals naturally. It's miraculous the way this happens. But when the nervous system starts to take over, people can end up way up here. And they can go with these ups and downs. So they're always at some level of pain, and then it just kind of drifts around up there. It gets a little better maybe for a little while, but then it gets stirred up very easily. Okay, so a lot of people do develop this. Now, these two guys, Butler and Mosley, they wrote a book back in 2003 called Explain Pain. That book has been one of my just Bibles of pain over the years, because these two, they're two Australian physiotherapists that have just done so much for the research and how to deal with this type of problem. Okay, just to show you, just to blow your minds here for a moment, how complex pain is, okay? This was a group of, I believe, 28 experts, some of the biggest names in the physiotherapy and physical therapy world, and they just say, what are all the different factors that can contribute to pain? Okay, and so the different colors give you an idea, but so much of it, so the white circles are the outcome, okay, so like pain often affects quality of life. But for example, individual factors, that's everything that's in yellow up there, okay? Psychological factors are the ones in this light blue over here, okay? All these things that can kick in. You've got biomechanical factors, which this biomechanical model is something, and biomedical model is something we've focused on for too many hundreds of years, and it's just in the past several decades that we've taken on much more this biopsychosocial approach, where you have to take in much more than just the biomechanics and the medical side of things. You have to take into account psychological situation, social situation. Those are extremely important. Now, this purple right here, this is all about this central sensitization I was talking about, where the nervous system gets overprotective, and it's just constantly protecting the body. Now, it doesn't mean you still may have tissue damage and all that exists somewhere in the body, but the brain very frequently will start to overcompensate. So I'm not going to explain each one of these colors, but you get the idea. The pain is a very, very complex thing. Okay? So how can physical activity help with chronic pain? Basically the main premise of this whole presentation. Okay? What is physical activity? Okay? So this is a long-winded definition that comes from the International Association for the Study of Pain. Okay? Any bodily movement produced by skeletal muscles that requires energy expenditure and includes purposeful activity performed with daily routines, blah, blah, blah. Okay? Here's my simplification of that. We just want any bodily movement produced by skeletal muscles. So basically anything that makes your bones move. Okay? And let's simplify even more. Move. Okay? Just, so often this is, I'm not going to say the solution, but too often people develop, when their pain happens, they fall into this vicious cycle. It's something known as fear avoidance. In other words, you avoid doing activities because of fear of the pain it's going to produce in you. So there's some people, they're terrified to just stand up from a chair every time. They, oh my God, when I stand up, both my knees are going to be killing me and they might buckle. Okay, and so that leads into this whole vicious cycle of disuse, more and more worrying. Another term that we use a lot, catastrophization. Okay, and so people will catastrophize something as simple as a movement. So there's so much research out there on the benefits of physical activity. Okay, and physical activity, you can call it exercise. For some people, exercise is a dirty word, so let's just call it physical activity. But there's so many forms of it. But this has been shown time and again. There's robust evidence on this. I mean, there's this one doctor out there who's got a popular podcast, and he talks about like just exercise and physical activity being like the ultimate pill. Like he always says, like, if I could give you a pill that could reduce your pain, give you more energy, give you a better quality of life, allow you to play with your grandchildren on the floor, stuff like that, would you take it? And usually the answer to that is it's exercise. So there's so much it can do. Reduce pain intensity, and it can also increase your pain tolerance. For example, I always wear these geeky looking shoes that they're called minimalist shoes. So my feet are very grounded. And I've found over time, this is one simple example. I was walking with my wife on the beach a couple months ago. And when we walked over some pebbles on the beach, because we were barefoot at that point, when we walked over these pebbles, she was going kind of, ooh, that really hurts. And I just kind of walked over and went, oh, there are pebbles there? Okay, and it's not that I lost sensation, it's just my feet have been more and more accustomed to that. So they've had that exposure. I can tolerate that kind of surface just because my feet have been exposed to it time and again. Okay, let's improve physical function, reduce fatigue, improve mood and mental health. There's a lot that's getting a lot of attention now. Increased energy levels, improve sleep, reduce risk of cardiovascular and metabolic diseases, enhance strength and flexibility, weight management, and bone health. Okay, that's a lot of stuff, right? Now, and people are fearful that a lot of things can get worse from doing physical activity. Take bone health, for example. And two of our physical therapists here, Nicole and Kate, they give an incredible osteoporosis class. A little plug there. We don't need the plug because there's too much of a wait list, right? But I mean, in the osteoporosis class, I mean, postmenopausal women are told like, oh my God, your bones are so fragile. But what does osteoporosis need? It needs loading. It needs even stomping. Like getting up onto a step or something, you stomp up to that step. Okay? You do a lot of strengthening for the body. This is what the bones need. The bones need more of this stimulus in order to get stronger. So we're not these fragile systems, and we can't let pain stop us from doing activities. Of course, we don't want to make people a lot worse, but people can get accustomed to these things. Okay, this is one last slide I want to show you, and then we can do some things that can help you, some strategies that can maybe be helpful with chronic pain. Okay, examples. Moderate intensity aerobic exercise. And this is something that's been put out for years, I think, by the CDC, talking about different types of things you can do. Brisk walking, swimming, cycling. Usually they say something like 150 minutes a week is what we want to get, but I mean, ideally we could do something almost on a daily basis, okay? Something that's not too demanding on your body, but something that's going to build the heart rate and just get us more involved, okay? This is something that is getting a lot more attention now, is strength training. It's not just for those, those muscle head goons in the gym that are just like chalk all over here. They're just spitting and everything. They got arms like this. And this is for everybody. Everybody needs strength training, and we need it more and more as we age, because strength is something that diminishes dramatically with each decade. And so it's something, lifting weights is a good thing. I mean, you can do a lot of body weight stuff as well. I mean, just doing something like air squats like this is a way to build some muscle, but usually you need to load it more. And so carrying weights, picking up weights off the ground, this is something that's really good for us. Okay, other movement therapies like yoga and Tai Chi, these have been around for thousands of years, and it's no accident. They weren't just some kind of trend that disappeared in a couple of years. This is something that's stuck around for a long time. And I'll say one thing that tends to be unfortunate, usually those of us that are kind of on the more stiff side, we tend to gravitate more towards like picking up weights or doing things that don't require a lot of stretching, whereas those people that are really bendable and stretchy tend to gravitate towards the things like yoga. And so like, oh yeah, I can get my head all the way to the ground when I bend forward. Well, for somebody like me, it's like, that thing, holding a position for a long period of time with a stiff spine, that's just uncomfortable and awkward. I'd much rather be throwing some weights around or something. So a lot of times we tend to gravitate towards the thing we do with greater ease, but it's not necessarily the best thing for us. And I want to finish with this idea that these programs should be tailored. They should be individualized, because too often, and I've seen this, I have friends who are excellent trainers, and Other physical therapists, I think the worst thing when you're at a party is to tell somebody, especially when you get around my age, people are getting in their 60s, it's just like, I'm a physical therapist. Oh, I got this shoulder thing. I mean, it's impossible to go to a party and not have somebody trying to like, you got an exercise for my shoulder? It's like, really? It's like, I feel like saying, well, do you have one investment for my entire portfolio so I can retire next year? It's like, it's not quite that simple. It's not like there's this one exercise that's magically going to cure us. So it's really important that somebody be thoroughly assessed and then get something that's tailored to them. Because if it's something like, if you give somebody even a series of exercises and they don't like it at all, it's not going to be beneficial. So I think exercise is something that should be enjoyed as well. Now this is just, yeah.
Speaking of enjoyment, I like to put in a plug for the Davis Senior Center, and they have line dance classes. And they start at absolute beginner, it's called AP, and it goes to moderate dance, and they're hours and hours of instruction, and it's really good and enjoyable.
I've heard that from many people, okay? There's one person in this audience I've tried to convince to go there, but I won't be looking at her at all.
The 9 o'clock Wednesday morning is for absolute beginners.
Okay, yeah, well, I've heard great things about that, and it's the kind of thing, there are oftentimes people who think like, oh, line dancing, what am I going to do there? And they end up loving it. And so a lot of times you need to explore and discover a little bit of things that you may not realize how much you enjoy. And so I think that's where you can rediscover the joy of movement, because it's something that should be, and you can incorporate play. I've had patients with really bad chronic pain, and because I've attended enough courses, and usually it has to be something they really value. If, for example, that incentive of, well, I really want to be able to play with my grandchildren on the floor, something like that. Okay, so maybe we need to establish something where you can get down to the floor and back up from the floor, and it's not going to be like we have to call in a crane to do it. Okay, and we want to get you. It may be a step-by-step, and it may take us months to get there. But it's the kind of thing, okay, we need some clear goals in mind. They have to be mutual, and we'll try to get you there. But if it's something you genuinely value, like if there's some activity you're just dying to get back into, usually that's the big hook. And that's the thing that makes a difference. So I will talk to people about things you miss in your life. And for example, I've had patients, they love dancing, but they're terrified to even try it because they've been in so much pain and they're so protective with their bodies and they're moving robotically. And all of a sudden, I'll just sometimes say, like, just do it. Just try. Just go home. Nobody's going to be watching you. Put on some music that you like, and you can start getting the hips into it a little bit. This will not be a dance class. That would be a disastrous presentation there. But just get the body moving a little bit. Just kind of rock side to side. Anything. Just something that's going to, and just let your body kind of move along with it. It's not like there's a correct movement for that or anything. Just move the body some to something that you have some passion about. Okay? Other questions right now?
I just want to say that I've got a bad knee, should be replaced. And I've gotten the second gel injection. And I see Matt, and I also have a trainer here. I can do the machines, but she does all the stuff, do this, do that. I have 19 exercises I try to do daily. I flew to Denver. My son had stairs that go up like that. I did those, I did fine. And I just keep acting with these things. And I mean, sure, sometimes we have to tape it, but I'm trying to avoid surgery. And I mean, I agree with this movement. And I'll think, oh, I'm so stiff this morning. You don't get your coffee till you do your exercises. And it's so, and a trainer can do, like she talks to Matt, and they know exactly which movements are good for my situation, my age.
Yeah, well, and that's the way it should be. I mean, unfortunately, we talk a lot about how, especially in the healthcare system, how we've all been kind of put in our own little silos. And so, like, you see specialists, they become more and more specialized.
Yeah.
And so all they know is maybe a knee,
Yes.
nothing else. Whereas to me, for example, there's this one physical therapist who years ago put out DVDs. It was called Training Equals Rehab, Rehab Equals Training. And so for him, it's always been this continuum. And so we should be doing both things almost simultaneously as long as the person can tolerate that. But it is the kind of thing, it's not like there's a dividing line between this gym and the treatment area. It's something, those things can be done in conjunction.
Right.
We just want to make sure everybody's on the same page and doing something for that individual.
And due to ovary removal and scar tissue, and some that this affects my knee. So I've got you here, look at the whole picture. And this is my pot of exercises for me and what I've got. I mean, it keeps me going.
That's
And,
fabulous. And I know, and Matt has probably educated you extremely well on something that's a deep part of our core philosophy here is looking at the entire body.
Yeah.
So it's not, I mean,
Right.
very often the knee, for example, is a victim to its neighbors. Because the hips and the ankles, if they aren't moving well enough in 3 planes of motion, a lot of times the knee will take on the burden, and this is something it can wear down over the years from trying to move in directions that it's really not designed to move in so extremely. It's not meant to take up all that slack. So very often, the knee is not the area, it hurts there, but the area that needs the attention is maybe the hip, maybe the ankle, or maybe even higher up. So we have to look at that whole picture.
And when you're
We're
on the
one
plane,
container.
the plane, I did the circles, I set the bulkhead and I do these, I stand up, and it's just like brushing my teeth. Because surgery doesn't always make it better, can make it worse, or, I don't know.
Well, no matter what, if somebody gets surgery, sometimes you do get to a case where, for example, if it's somebody who every single step they're just in agony, I mean, sometimes structurally speaking, the surgery has to take place.
Right.
But everything that's been done as a prehab before surgery is something that should only be beneficial to the recovery. Because that person's going to have to go through intensive rehab after that surgery.
Oh, yeah.
And do all the things to avoid getting back to what caused the problem in the first place. So, it's just some simple things you can try, especially if you feel like your nervous system's really amped up, you're stuck in traffic, saying it's like, dude, you're over gripping the steering wheel, and go ahead and make fists right now. Just make 2 fists, okay? And hold that for the next 20 minutes. Okay? Your wrists and your elbows and forearms are not going to be very happy. Well, there are a lot of people in chronic pain that are living like that always. Okay? Especially, I mean, I've seen the most extreme examples I've seen mostly for the low back. So people well, first of all, they've been taught that they have to sit like this at all times. Okay? Everybody just assume this posture. Like, assume what you consider correct posture. Feet flat on the floor, you're sitting on your tailbones right here, okay? And keep your spine as long as you can and stay upright, okay? Imagine just keeping this posture for even 10 minutes. Do you think your body's gonna feel good 10 minutes from now? Okay, like right now, I'm already starting to feel some low back, I don't feel pain, but some low back tension, okay? Now, I'm giving you major permission to slouch. Go ahead and just kick back like a teenager, watching TV for 6 hours here, just like, okay? Just kick back like that. Oh, my low back muscles are nice and relaxed now, okay? This is okay. But is it okay for an entire Netflix movie? No, okay? So that's why I said before that your best posture is your next posture. So it's okay to squirm around. And be off to the one side, off to the other side for a little bit. But we need to be changing around a lot. Something I love to get while we're in this neighborhood, just moving all the spine muscles. So some of you have probably done the cat-dog type exercises. But even here, I want you to think of moving bones. We're not activating muscles, we're just moving bones. Okay, so you feel those sit bones down there? Okay, more cocktail party knowledge for you. Those are called your ishiotuberosities. Okay, so you're sitting on your ishiotuberosities. So go ahead and let's just kind of, and that's like your rocking horse. Just kind of rock back and forth. And so when you rock forward, your pelvis is tilting forward. When you rock back, you go kind of into that slouch. Okay? And then if you want to make it a little bit more fancy, get your breath involved. This works driving, by the way. And driving works pretty well because you have this headrest there. So when you breathe in, the head's still in contact with the headrest. When you exhale, you just kind of look back. But you got to keep looking through the windshield. Okay? Can't be doing this and this. Okay? So it's just as you breathe in, you get length in your spine. As you breathe out, you just kind of slouch down like that. I mean, if you're stressed driving, do 5 breaths like that. You should notice your stress level changes at least a little bit, and even hopefully your pain level, just because you got a little bit of movement right there. And if you want to get a little fancier with it and get a little hula hoop going in there, you can do that too. Just kind of rotating around one way, you go the other way. You didn't know this was going to be a chair dancing class, right? Okay, good. So like that. While we're on the subject of breathing, I think breath is our best shortcut to go from the sympathetic nervous system to the parasympathetic nervous system. So from fight or flight to rest and digest. Okay? And so you've probably learned about belly breathing, but let's start with just our high-low. Place one hand on your chest, one on your belly, and just breathe in through your nose, and just gently blow your mouth. And breathe in. Exhale. Okay, and so usually breathing like this, everything should, on the inhale, everything should expand a little bit. Okay, so we want to get something at the belly and a little bit at the chest. Ideally, we want to go a little bit from south to north. So you want it to start around here and work its way up. It's just this gentle. But you don't want to be, okay? It's not like that. This is just gentle. Everything's expanding. Exhale. Everything's relaxing. Okay? Now, when it comes to the diaphragm, and the diaphragm there's some of that belly breathing, but ideally you also want some lateral rib expansion. So if you can, place your hands on your ribs here, okay? And breathe into your hands right there. This is like you're giving yourself a fake girdle, okay? I don't get to say that word very often, girdle, so. It's a different time period, right? So breathe into your girdle. Just usually doing like 3 to 5 breaths like that, it can really just change that over intense cortisol-driven attitude to something that's just much more calming. Okay? There's so many different forms of breathing. Some will say, you got to be precise. A lot of times it's just focus on the inhale and the exhale. Usually I like to do the inhale through the nose, exhale either through the nose or through the mouth. If you want it, generally a long exhale is very beneficial for helping get the blood flowing all through the tissues, get oxygen to all the tissues. And so sometimes I like to exhale, and this has been shown to really slow the heart rate as well, when you exhale through pursed lips. So where it'd be something like this, where you breathe in through the nose, then exhale like you're blowing out candles. So a nice long exhale. And so doing something like that can really slow down the heart rate, and it can really calm down. I'm putting everybody to sleep here now. Yeah, it's working. This isn't to get you amped up class, right? Okay, but that's the kind of stuff that can be helpful. So that's breathing. There's other things like known as box breathing. I don't know if you've heard of this before, but this is used, Navy SEALs use this sometimes to really calm themselves in really tense situations. where they, usually it's 4 seconds on each. So where you breathe in 4, hold for 4, exhale in 4, and hold for 4 again. So it'd basically be hold, 2, 3, 4, exhale, 2, 3, 4, hold, 2, 3, 4, and repeating that several times. That's something that can also calm down a tense situation. Okay? So those are some, breathing is your best friend for just really making that quick shift, because it's one of the few things we have to do it no matter what, if you want to remain alive. But it's also something, it's not only automatic, it's something we can control. So conscious breathing can be a great way to help. Like if you're in a lot of pain at some point, getting into a comfortable position, you could be lying on your back with your knees bent, or wherever you're most comfortable, and just spend some time focusing on the breathing. That can be a great, and again, these things have been around for thousands of years, but now there's lots of science to back all of this up. Now, when it comes to, for example, going from a sitting to standing position is something that can be pretty painful for people. But if you really use the legs a lot, that can be quite beneficial. So for example, if I'm going to go to stand up from here, rather than just overusing my back, or some people will really over around their back, or they'll kind of hesitate and then drive too much through their knees. Usually, well, first of all, is anybody hurting right now just sitting there? You all good for now? Okay. Well, go ahead and get into kind of this position, just kind of leaning forward, leaning right over your, that's it. Just kind of breathe there for a second and just let yourself relax. That's it. Okay, good. Now, go ahead and kind of reach down towards the floor. Okay? Now, this can be really scary for people with back pain that are terrified to bend forward. Okay? Now, let's say I wanted to get up from that position, but I want to do it all in one motion. So what I can do is really, to not overtax my back in this case, I'm really going to use my legs. So what I'm going to do is bend forward and just push through my feet. Just drive the feet into the floor and go. Okay? If it's painful, I understand that. But really, okay? And then when you go to sit down, just kind of bend forward. So watch what I do is I just come forward, I'm driving through my feet. Just come maybe a little more to the edge of the chair. Just a little further to the edge of the chair. Go ahead and come separate your legs just a little. Reach towards the floor and push through your feet. Go ahead. I'm not going to let you tumble, I promise. Just go. Push. Go again. Push through the feet. Nice. Good job. Okay? And then, to come back down, I want you to still feel the weight into your feet. Just kind of push your butt back and come down. There you go. Okay? 50 more times. Let's go. Okay? But just really driving through the feet to get yourself up. Let the legs do the work. The legs are made for this. You got your powerful muscles all over here that can do that. Okay? And so that's a way where you can get more confident. If that's painful on the knees, okay, I think another good thing to do, so go ahead and stand up again. I give hip hinging to most patients I see. It's not necessarily the answer for everybody, but a lot of times, if you initiate with the knees, that can be pretty painful in the knees. So really, a hip hinge, it's almost like doing a bow, but I'm still keeping my knees soft. I'm just bowing forward like that. Okay? So I bow forward, pushing my butt back. When I go to come up, I pull my hips forward. That's it. So push your butt back. Then you go to stand up, pull your hips forward. Okay? So you're going to Yeah, that's, so it comes from this article, and the article's at the very bottom. Let me just go to the references here. I've got references at the very end of this
I'm
program.
very
Yeah.
intrigued by
So, one
that.
second.
And right off the bat, when you were mentioning, a couple of different areas, I'm like, oh, yes.
So this one right here, so it's this article right here, this one on can biomechanics research lead to more effective treatment of low back pain? And you can find that image online. But yes, it is so complex that all the things that contribute to pain. It's so multifactorial. You can't simplify it just to a little bit of an owie from tissue damage or something. Like I tweaked my knee. Okay? An interesting thing about, I'll give myself as an example. I hate to use myself as an example too often, but I guess it's part of the profession. But back in December, I hurt my knee doing stupid stuff, thinking my body's not as old as it is. And I tweaked my knee, and I got to a point where I really wasn't in that much pain when I was just going about my day-to-day activities. There were some activities I had to be careful on, but one thing, I still had sharp pain at night when I was lying in bed. Okay, and you're thinking, well, I'm lying in bed, I'm not doing anything. So for at least a good month after the injury, I could not sleep on my side. Either side, even with a pillow between the knees. Everybody tells you all the tricks to try. And so it's interesting, it's something like, because the brain is constantly evaluating everything. Well, I don't have those same distractions at night as I do during the day. My brain has a chance to say like, oh yeah, that knee, and it'll start to say like, I don't like you lying on your side right now, so get off of it, or I'm going to produce a pain that you are not going to get any sleep and you're not going to enjoy. So I had to sleep on my back for at least a good month. After a while, it did go away, but there are many people that this just persists and persists and persists. So it does take, and I would try to do some of that graded exposure. And after a while, I got to a point, yes, I can sleep on my side again. But it took, I'd say at least a couple months till I could solidly sleep on my side again, which is my go-to position. So it's interesting the way pain works. But just when you think, oh, everything's good, the brain will remind you, nah, I don't think so yet. I'm not ready to let you do that yet. So you got to just work with it. Get used to it. Graded exposure. Okay?
Thank
So,
you.
thank you all for attending. Appreciate it.